So let's get straight into it and start with you telling us a little bit about who you are and what it is that you do.
All right. My name is Dr. Soni. I founded Holendo, which is a naturopathic medical clinic in 2021. We focus in holistic hormone care. As a naturopathic care provider, I help patients with holistic treatment plans. I do a lot of hormone balancing, and I especially have a focus in supporting women with endometriosis.
Oh wow. What inspired you to do the work you do? What made you kind of focus on endometriosis?
Good question. So we can even start from the very beginning. My undergraduate studies were in biomedical engineering. And during that time, I got a close look at what it takes to bring a drug device out to market and have the research out there. So we would look at some of the top causes of health issues in America. So in chronic diseases would come up across the board, things like heart disease, cancer. And then when we were brainstorming solutions for it, in those solutions, anything that could not be patented was not considered as an option. And so as a result, I got to see how much intellectual property rights drove the research body out there in the United States, and specifically how that plays a role in medical education in the United States. Growing up, I was born in India. My family was always first to use natural remedies whenever we had any concerns. Homeopathy was used regularly, and I think you know about all the richness of Ayurveda and the herbal medicine. So that's what was familiar to me. So I always felt like there was a missing piece, and the statistics show it too. So we do great with ER treatments and ER visits, but as far as prevention goes, there's quite a bit lacking. Maternal mortality is improving everywhere, but it is getting worse in the United States. And I think it's because prevention is missing. When I learned about naturopathic medicine, it gave me that holistic balance between getting the best of modern medicine, being up to date with all of the treatments out there. We have a full scope where I practice in California, but also having your training grounded in holistic treatments, nutrition, lifestyle. So if someone comes in with a health concern like blood pressure, I know exactly what herbs or exactly what lifestyle changes, if they're willing to make it, will drop their blood pressure to a similar degree as a daily pharmaceutical. And as a naturopathic care provider, I get to take that time with patients. It's pretty common for me to spend an hour with patients because it takes time to get to the root cause. When you're getting younger and younger people presenting with chronic diseases, slapping on the medicines, they provide a short-term fix, but at some point, they're going to want to deal with why it's there in the first place. So, something as simple as acne, antibiotics definitely help in the short term, but at some point it stops working. And then you might have birth control as an option versus a naturopathic medicine. We take a holistic approach. The cause of acne is going to be different in each person. I start with the gut. I follow up with looking at the immune system. So for example, is there any yeast overgrowth in the gut contributing to the skin issues? Do we have to open detox pathways? Our skin is a major detox pathway. And lastly, it's about hormone balance. And so that hormone balance piece brings me to endometriosis. It's a condition that thrives when there's too much estrogen, not enough progesterone. And we're seeing that, unfortunately, quite a bit these days. Our environment has changed. So, for example, most people are familiar with the chemical BPA. As Americans, we're carrying higher body levels than ever before of endocrine disrupting chemicals, which is an example, which is BPA. BPA comes from plastic. It's also in food cans and packaging. When someone eats canned soup, BPA levels increase more than 10 times. Endocrine disruptor means it disrupts the same areas that your hormones bind. So your body is less sensitive to the hormones because those enzymes are bound up by these chemicals. And that can contribute to increasing rates of aging, doubling the risk of diabetes, but also it's a synthetic estrogen. So it contributes to a state of estrogen dominance. So I'm really passionate about what I do because of the environmental component of it. I think the body has an amazing capacity to heal, especially when we take out some of these stresses that are preventing us from thriving. And endometriosis is a really complex disease. I think the uterus is pretty amazing. It has some really great detox capacities. So I see it as an opportunity to listen to the body more and investigate root causes. And it's a journey. It can take 3 months, 6 months, but along the way, we're making sure that we're aggressive with getting that hormone balance down correctly, opening up the detox pathways, resolving concerns like bloating, getting people out of exposure to things like mold. Sometimes we're even investigating, okay, are parasites part of why a person's liver is burdened and having a hard time with detoxifying chemicals in the environment.
Wow, you really do cover everything. That is so encouraging to hear. Do you find in your practice that you have people come in and they have a certain type of symptoms, but they don't actually know that they have endometriosis?
Absolutely.
Yeah, I was going to say,
Yeah.
what does that look like? What kind of symptoms show up when you have that imbalance that you mentioned earlier?
So they're the classic symptoms of endometriosis, which are pain with sex, painful periods, pain that's in other areas other than your pelvis during your cycle. Some people have pain with bowel movements, pain on urination. There can even be endometriosis on the diaphragm, which can contribute to pain, chest pain during the cycle. So those are some easy clues that endometriosis might be playing a role. There are people who don't have any symptoms either, and it's just they've been trying to get pregnant for quite a while and they haven't conceived yet. And then that chance of endometriosis is about 50% as a culprit of the infertility. So those are some of the common and less common symptoms of endometriosis. And in my practice, I have been the first person to diagnose it in quite a few people. Some people have bladder pain, urinary frequency that's been going on for tens of years. And when we start them on this endometriosis treatment plan, it gets better. They're able to sleep at night finally. So I think that the right diagnosis makes a big difference for a person. And in the US, it can take up to 8 years to get that diagnosis because we tend to normalize pain in menstrual cycles quite a bit. And they say a woman going to the ER with abdominal pain, she's less likely to get imaging for it than a man because it's so common for women to be in pain every month. I think that's another thing that has to change. I think pain is a signal that something's not okay. And it's a conversation to have with your healthcare provider, not necessarily slap a patch on to silence the pain. That's over the counter. Anyone can take medications, but with your healthcare provider, I hope you have someone who's a detective and looking at root causes. Is it because of magnesium deficiency or a vitamin D deficiency? Our soil is much more depleted in micronutrients than even since 1960. And that's a result of, pesticide, glyphosate being used on it. And as a result, if you're purchasing non-organic foods, that food is also tends to have higher concentrations of not just pesticides, but even things like heavy metals. And all of those can be disruptive to your hormone environment. So, a lot of it is lifestyle change. I think picking organic food definitely is a must, but we're seeing a lot of gluten sensitivities, dairy sensitivities, because the food quality has deteriorated from what it used to be.
Yeah, I was actually going to say when you had kind of spoken about the symptoms, I was thinking, crikey, there are probably a lot of women who go through all kinds of pain during their periods and just think, well, I'm on my period, so this is to be expected, and just hope that it goes, and when it does, just kind of brushing it under the carpet.
Yeah, that works for a while, but just if you don't take action, it can get worse. It can create other issues down the road.
Yeah.
Hopefully if people have the time and space to investigate, and when you're dealing with the cause, you can help quite a lot of other systems in your body too. So if it is a magnesium or vitamin D deficiency, by dealing with those root causes, you're also improving your bone density down the road.
Yeah.
So I really do think being proactive with what your body is telling you can make a big impact.
Definitely. And what does working with you look like? Do people, I'm just thinking about the different people that might be listening to this and feeling just kind of safe because of how much you know and how much you care about this area. They might be thinking, oh, I need to work with her. I need to see her. But would that be accessible for everyone? Is there like, virtual ways that people can work with you, or do they have to be in your area?
Yeah, I do telemedicine. So I have both options, in person or virtual. Um, yeah, and what does it look like to work with me? Usually that first appointment is quite a bit long and we get to everything, get to digestion, how are you sleeping? So get prepared if you haven't been to an integrative appointment before. It's good to bring in any labs you might have done in the last year. And then follow-ups, they're usually about 6 weeks out to give 4 weeks for the recommendations to take effect. Perhaps there's another menstrual cycle that happens in there. So that's that pacing. And it is possible to have check-ins in between as needed. But working with me, it's going to include some dietary recommendations, lifestyle investigations. So here in California, we have a lot of forest fires. Some people do need to be using a HEPA air filter where they sleep, for example. Another thing that's a common concern here is the water quality. We have a lot of hard water, and it can make conditions like psoriasis worse, hair fall worse. So sometimes there is some lifestyle investigation that we do depending on the concern. Yeah, so those types of recommendations will be in a comprehensive treatment plan.
Amazing. And it's different, it's going to be different for everyone, which I guess that's also a great comfort to know that it's not, try that when some things people could be trying that work for others and it hasn't for them. So yeah,
Yeah.
I love how thorough
And
you are.
exactly. There's people also have a willingness to what they're able to commit to and do. Not everybody is ready to make some of the dietary changes off the bat. And so we can start low and slow, talk about more of what to put in instead of take out. So yes, it's going to be different based on each person. Some people are okay taking supplements all day. Other people really can't. They want to do as much through food as possible. So it involves the patient being a very active participant in the treatment plan so that we then can set expectations, right? If you make these changes, what can you expect to see change?
Yeah. And can you share maybe a success story with us, or an experience that you've had where somebody came in kind of at their wits' end, not really knowing where to, what to do basically, and just working with you has kind of turned their whole life around and made you feel really glad that you do the work that you do?
Yeah, I think great at helping people with bloating, resolving root causes of bloating. You'll see a lot of that also on if you Google me, and you can read patient stories there. Specific cases, I've had quite a few patients who've been wanting to get pregnant, and just a couple months of starting some of these recommendations, they are able to conceive and have a healthy, happy pregnancy. I even think it's great if we have 2 years before someone conceives so that we can make sure the optimal sperm meets the optimal egg. There's quite a bit you can do in preconception, in supporting detox pathways that you can't do once you're trying to conceive, because you don't want to be detoxing during that time. Detoxing involves mobilizing toxins, and you want to expose a possible baby to that. So I do like to take that 2 years prior to conception, but that's another success. A lot of success stories I've had have had to do with helping people conceive naturally, addressing some of the root causes there. And I think I mentioned earlier about a patient who had 10 years of chronic bladder pain and frequency, and being able to resolve the pain using holistic natural treatments related to endometriosis.
Wow. And if you could leave, this just came to me because I just thought, let me try and pull this out and get some tips out of you. But if somebody is watching this and they just want to start being a lot more mindful about their health, what 3 things would you say that they should take into consideration? That doesn't necessarily have to have, just 3 things that they could act on today.
All right. I think sweating is really important. Sweating is a great way to eliminate heavy metals from your body. The skin is a big detox organ. So sweating just even a couple times a week. People will exercise, but they won't sweat. But I actually want you to sweat, and the sauna can do that too. So that's going to be my top recommendation, sweating to support detox pathways. This is really important because nowadays I'm hearing about people who are even Botoxing their armpits to stop sweat. And you just want to wait for a second because you're closing up that major detox pathway. If sweat has odor, that can be because of a dysbiosis in the microbiome. So I think the top thing to do is look at your gut, get a proper comprehensive stool analysis if you are concerned about your odor with sweat. But actively making sure you're sweating 2 to 3 times a week, it's going to help you detox. Second thing that's really important is I think just in your shower, ending on cold can make a huge difference for your nervous system, immune system, and your lymphatic system. Wow. Because it switches the blood flow towards the organs, which is great for detox. People do alternating hot cold showers. That's even better if you can alternate. But if you just end with a cold plunge, it's really great for all your fat cells and your detox capability.
I've heard of cold plunges in like the ice baths, but I've never actually heard of doing it like that. What about a lukewarm shower? Does that count?
No, it doesn't. You can start with lukewarm. You can start with whatever temperature you like. If you like hot, just end on cold. That's the most important thing.
Brilliant.
So it can resolve depression with the nervous system reset too. And it's just a cold burst. So people in the alternating hot cold shower, they'll spend 3 times as long in hot as cold. So it's really just a burst.
I'm gonna start that. Thank you.
Yeah, all right, great. Okay, so we have so many, so it's hard to pick the top one. I think we already talked about eating quite a bit. So I really encourage people to eat with their circadian rhythm. So I do think breakfast and lunch are very important meals, especially for women in keeping blood sugar and hormones balanced. Oftentimes we make dinner the heaviest, which doesn't make any sense because we're going to go right to bed. You're not necessarily going to use it as fuel. When you eat a breakfast or a lunch with protein and plant-based fat, you can set yourself up for steady insulin levels. You prevent insulin and glucose spikes and surges. When you're having glucose spikes and drops, that can cause cortisol, adrenaline, some of our stress hormones to be released. So a big way to deal at root causes of poor sperm quality or PCOS, even pre-diabetes, is just start your morning with that big breakfast and lunch, and dinner, keep it light. If you're trying to fast, I'd rather someone skips dinner unless they have sleep issues, then go ahead and you might actually need a protein snack before you go to bed. But I really don't like people skipping breakfast and lunch when they have hormone concerns.
Yeah, they were great. Thank you. Especially mentioning the fasting, because we all think and feel like we're doing great things for our body when we're fasting, but you have to take everything into consideration.
Yeah, you have to be careful with fasting. So for women, you have to do it along with the menstrual cycle. In the follicular phase, fasting is a lot easier than the luteal phase. In the luteal phase, which is after you ovulate, it's about cycle day 14 to when you start your bleed. That's when you're more sensitive. There's more insulin resistance, and fasting can prevent you from having a healthy progesterone peak because fasting can bump up your cortisol, your stress hormone. So I think the follicular phase, you can take more risks. Start carefully, 12 hours, 16 hours. And know that everybody's bodies are different. So if your partner has no problem fasting, doesn't mean that's right for you. So it is a conversation to have with your doctor.
Amazing. Thank you for being here, and thank you for today. Thank you for all of the gems that you've given us. I know there's a lot people can take away today, but also just to get an insight into what you do in a clear way. So thanks.
It's my pleasure.
Well, yeah, I look forward to talking to you again soon, and yeah, sharing this interview with the rest of the community. So you enjoy the rest of your day, and we'll be speaking soon.
Thank you. Take care.
Thank you.